There is growing discussion in the UK about providing British migrants with private healthcare options to alleviate the pressure on the NHS, especially as patient demand rises amid a strained healthcare system. The concept is based on encouraging migrants, including retirees moving abroad and British citizens living overseas, to consider private healthcare options for any treatment they might need back in the UK. The goal is to minimise the impact on NHS services, which are increasingly stretched by staffing shortages, record-high patient waiting lists, and demands from both domestic patients and returning British expatriates. Background and context. The NHS, a publicly funded healthcare system, has historically faced pressure due to the large volume of patients it serves, exacerbated by budget constraints and workforce shortages. Over the years, British nationals who live or work abroad have often returned to the UK for medical treatment due to familiarity with the NHS, cost-free access, and comprehensive care. However, as the system faces growing challenges, this practice has sparked debate about how returning Britons should engage with healthcare resources in the UK. In recent discussions, policymakers and health economists have proposed that returning expatriates consider private healthcare options, especially for elective treatments and non-emergency care. This approach could help relieve some of the burden on the NHS, allowing it to focus resources on domestic patients with acute or urgent healthcare needs. Proposed benefits of private healthcare use: reduced wait times. By diverting some of the demand from returning British citizens to private care, NHS resources could become more available for UK residents, potentially reducing wait times for treatments and procedures. Improved resource allocation. Private healthcare options for migrants could enable the NHS to better allocate resources, allowing for a more efficient handling of acute cases without sacrificing service quality. Flexibility and choice for patients. Private healthcare options also allow returning migrants to access a broader range of treatments and facilities, as well as reduced wait times for non-emergency procedures. Criticisms and concerns. While the idea has garnered support, there are concerns. Some argue that encouraging private healthcare could deepen inequalities, as not everyone can afford private insurance or out-of-pocket medical costs. Additionally, critics worry about the implications for NHS accessibility and the principle of universal care. There is also debate around how private healthcare access could impact the healthcare workforce, as any increase in private demand could draw staff away from the NHS, compounding existing shortages. Next steps. The proposal remains under consideration, with ongoing research into how NHS capacity could be maximised while accommodating the health needs of British citizens living abroad. Policymakers are also weighing possible incentives or partnerships to make private healthcare an attractive and feasible option for returning Britons. The debate reflects broader conversations about the future of NHS funding, resource allocation, and the role of private healthcare in supporting a public system under strain.